All right, welcome everyone to today's webinar. We are better together, partnering with youth affected by parental drug use to meet their needs. This webinar is provided as part of a partnership of stakeholders that are supporting grantees of the Bureau of Justice Assistance and the Office for Victims of Crime to address the opioid crisis and other substance abuse issues, particularly the impact of substance abuse on children. The Center for Victim Research and the Justice Research and Statistics Association are among the stakeholder partnerships. And I do want to remind you that while we have federal funding that supports this webinar, the points of view that our panelists present today are their own and do not necessarily represent the official position or policies of the U.S. Department of Justice. And with that, I would like to turn things over to today's speakers. We have Dr. Terrinieka Powell, Mr. Darian Glover, and Dr. Asari Ofiong, who will be presenting our webinar today. So with that, I turn it over to you all.
Good afternoon, everyone. I'm going to share my screen. Just give me 2 seconds to do that. Good afternoon. I'm Dr. Terry Powell, and I'm joined here by my colleagues, Darian Glover and Dr. Asari Ofiong. And so we are thrilled to be meeting with you today to share a little bit about the work that we're doing. So I always like to start off first with acknowledgement. So although you see us, this is really the blood, sweat, and tears of a lot of folks. First and foremost, I'd like to thank my funders who funded the work that we've been doing over the past few years. Our partners, which include young adults, the library system here in Baltimore, Maryland, where we're located, as well as the Johns Hopkins Center for Adolescent Health, who provide support. We have a number of consultants that we've hired along the way. All of the pictures that you see today throughout our presentation were taken by our 17-year-old youth photographer. So enjoy, and if you want her name to shoot some photos for you, we'd be happy to share it, her information. Of course, the participants who've allowed us to be a part of their lives over the last few years, and our research team who keeps the engine going. So here's our roadmap for today. We first really want to make the rationale for why we use a partnership approach to the work we do. And then identify some ways that you might be able to incorporate youth voices into your programs. And then use the model that we've used, do an actual, like some thinking part of it. So to help you apply what we've done to your organization. And so the way we'll go through this presentation really in the phases of the work that we've been doing. And so we'll start here with the phase 1, which is our Better Together project. Better Together is a multi-phase study based in Baltimore. And the goal is really to prevent early substance use among Black youth affected by parental drug use. We did not labor you with all of the statistics. We believe that you know them. You're here. You're a grantee. But we really wanted to point out is that it's been community driven and participant informed along the way. And so this phase, what we'll talk about right now, is phase 1, and it's a part of a larger intervention. Phase 1, we interviewed families families affected by parental drug use, but then also providers who serve these families. In phase 2, we developed an intervention in response to what we heard from families and providers. In phase 3, which we are hoping to start in the fall, I'm sure like us, COVID interrupted some of your plans. So we're hoping to start in the fall, will be a library-based intervention for young people affected by parental drug use. So let's talk a little bit about phase 1. So, we are big believers that if you want to know something from somebody, you should just ask them, right? And so that's what we did. We asked young adults and parents, 14 young adults, and we have the eligibility here. And we were specifically asked young adults and not youth because we believe that young adults would have a little bit more time away from their experience living with their parents. Affected by their parents with a history of drug use. And we also didn't want to cause any additional trauma. And so we thought that thinking about asking young people, young adults to reflect on their experience made sense. And we also talked to parents who were either in recovery or actively using, who had children. And they had to live in Baltimore. You see the sample there. And so we recruited people through our community-based partnerships that we'd already had through other networks. We scheduled all of the interviews at a time and location that was convenient for our participants. And we also made sure to offer transportation. And lots of times when people hear offer transportation, it's bus passes, but you know, it gets dark early here, and if people wanted to interview late or early, we wanted to make sure they felt comfortable. So we arranged a Lyft or Uber ride. So we used ride sharing services, and we budgeted for that early on to make sure that we were able to provide those services to anyone who wanted to work with us. And so we talked to these folks. And so there were really 4 major findings, and I'll go through them quickly because again, this may not be new to you, but the way that we use them, we hope that we are doing the work that you're doing justice, and also we're being responsive to the people who spoke with us, the families who spoke with us. So the first thing we heard is that drugs are everywhere, and so there's just this idea that when we're thinking about prevention, we don't always consider that drugs literally are everywhere for some young people, especially those affected by parental drug use. It's not just like, oh, watch out for your peers who are using drugs, but it's watch out for your parents, watch out for your parents' friends, or your cousins who may come to your house, or around the neighborhood, the people who are selling and using. And so this idea of just the oversaturation of drugs in the communities in the families that we spoke to really came out. And so one of the things that we thought about as we develop our intervention is, how do you deal with that, right? Like, how do we help young people deal with that? Just say no feels like an every hour on the hour decision to make. So how do we really wrestle with that as young people are trying to make that decision to remain substance free? The second thing we heard a lot about is that there was repeated trauma. So often repeated and complex trauma situations. This included neglect and abuse, but then also frequent deaths, right? So this excessive death, the idea that young people were seeing people die, some from natural causes, others not so much. So whether it's related to community violence, HIV/AIDS, drug overdose, there were lots of like close relatives and friends and family dying around young people. And so the trauma really, the types of, so it wasn't a matter of how much, but when, like when is the next time something will occur? And so any of you out there who are thinking about or using measures of trauma or adverse childhood exposures, I would encourage you to think about not just asking like if something occurred, but like the frequency in which something occurred, because sometimes it's not just post-traumatic stress, it's current traumatic stress, and young people are dealing with it every day, all day. The third thing that came out was unreliable housing. And so this idea that often because of or in response to a parent's drug use, young people had to move, right? Either they got evicted or their parents weren't there, and so social service became involved. And we found that our young people, most of them moved no fewer than 5 times, and a lot of those moves occurred before the age of 5. And over 50% of our young people in the sample also experience homelessness at some point in their lives. So as we're thinking again about prevention, like what does it mean? Like if, for us at this high level to be thinking about prevention or substance use reduction, if folks aren't feeling like their basic needs such as housing are met. And then the last big thing that we heard about was a fractured support system. So it wasn't necessarily that people weren't supported, but it was that it was inconsistent. So Susan found us from a paper that we published about this called I Missed Open Arms. So this idea that people, grandparents were mentioned as supportive people, but when grandparents died, folks felt like they didn't have a lot of other support. Or for example, when some of the young people who experience time in the foster care system, they suggested that they'd have a somebody, and then that somebody would leave, or they would leave that home, and they reported like feeling like the only people who were there to help them were people who were paid to help them. And so again, thinking about what this means for prevention, we started to really think about like how do we help empower young people to choose who they want to be in their lives, and figure out also managing when people leave? Because even when we're not in families affected by parental drug use, people leave, right? And we all need to think about how to handle that and how to manage that kind of stress. So taken together, these 4 things really make folks feel unsafe and unstable. Like this idea, they never knew what was coming, and so they were often responding to situations as they came, and building their like toolkit for how to manage them on the fly. And so again, I think that we can do better for young people, and I hope you agree. And so now I'll turn it over to my colleague to talk a little bit about us working with young people.
Great, thank you. Can everyone hear me? Can you all hear me clearly? Okay, great. Thank you, Dr. Powell. So in this next phase, we're just going to talk about the case for partnerships. So as Dr. Powell mentioned, we started off in phase 1 talking to families, and then understanding the beauty and also including them in our work. And so in this section, I'm going to talk about community-based participatory research and the principles that we used. Next slide, please. So prior to being in research, I was a public health practitioner. So I know, and I'm very familiar with tons of substance use prevention programs such as Life Skills or Strengthening Families, Guiding Good Choices, Project Toward No Drugs. There are tons of them. But a lot of those programs are more universal, not necessarily indicated or targeted towards young people affected by parental drug use. And in honesty, it's really difficult to identify and attract and maintain young people who are affected by parental drug use for a lot of the reasons that many of us know, and even based off of the findings from our qualitative study, right? People are moving, lack of trust, or just fractured support. So it's really hard to engage those young people in prevention efforts. And specifically, our work was targeted towards Black adolescents, and very few of the interventions or the programs that are created address the specific needs of Black youth, both culturally and socially. And so that's what kind of arose our ideas about creating a something or adapting a something to meet and align with the needs of the young people that we spoke with. And then on top of that, a lot of those prevention efforts are based in schools, which makes sense, right? If you want to target young people, we're young people for sure. They're going to be in school for sure. But there are a lot of stipulations that come with working in schools. Teachers and supports are already stretched, and there are limitations with how much teachers and or paraprofessionals can support young people with. And then also identifying that teachers and in the school system, they're mandated reporters. And so for a lot of the young people, excuse me, that we worked with, they knew that information and they were reluctant. They stated being reluctant to sharing some of the issues that they had as a result or a consequence of their parent engaging in substance use. And so for that reason, when we think about the efforts that we do have, there's still room for us to do some new things. And so that's what we're going to talk about how can we incorporate and partner with young people to make something that is both relevant and salient to their lived experiences. Next slide, please. And so one of the ways to do that is community-based participatory research. I'm not sure how many of you have heard about CBPR, but sometimes people use it interchangeably when they just like ask a question, but it really is a methodology, a research methodology that is aligned with principles. And just to kind of give you the definition of CBPR, CBPR is an applied collaborative approach that enables community members or the community of interest to actively participate in the full spectrum of research. So that means from design to data collection, to analysis, to interpretation and dissemination. True CBPR includes community members actively in every step of that and not just in the middle when you're just asking them a question during data collection. And with that in mind, there are many benefits to CBPR as an approach. One, it addresses multiple factors. As you're working with people and aligning the research with their lived experiences, then you're able to identify maybe more factors than you as a researcher might have thought about. It illuminates that during that process. It enhances relevancy and use of the data. So a lot of us are funded through public and private funds, and we want to make good use of our dollars. There's nothing worse than making a good thing, but a good thing that's not right for the people that you're working with. And so we want to make sure that our programs are relevant and that the data that we have, we can actually use it to make inferences. And increases authenticity by having folks work with you over a long period of time. It shows a commitment that you have to that work. It has a commitment to that community that you're working with and a commitment to the issue that we're trying to address. It strengthens the quality and the validity of the research. And it also increases resources for communities involved. And so not only, we're going to talk about specifically incorporating young people, but by doing a CBPR project, you may connect communities to more research or funding opportunities that they might have not known about before, job opportunities, and even more than that, building a skill set, giving new language and giving more opportunities to research that they would have not known before. And lastly, but actually the most important part of CBPR is that it creates an opportunity for co-educating and co-learning. It's a bi-directional benefit. Most times CBPR is done with researchers in a community setting. And so it's not just about the researchers coming in to say, this is how things are done, these are the issues, but it's really about teaching maybe new language around, for example, we're public health professionals, so we may teach about social determinants of health, but then our community members may also teach us about these are the norms, these are the customs of this community, these are the needs, these are the assets, these are the reliable people. So it really is a bi-directional benefit of educating and learning for both participants. Next slide, please. So specifically, we work with young people. Young people are at the center of our work. And so we're really driven by the principles that I just mentioned for you before. As you guys might remember, when you all were registering for this webinar, we asked you how young people are integrated into your programs, if they are. And a majority of you stated that youth are consulted, but activities are driven by adults. Another good chunk of you stated, about 30%, said that youth are invited to events. And then about 10% stated that young people actually initiate and carry out programs. And then another 10% said that youth are not actively involved. And that could be for a variety of reasons, I'm assuming, depending on what your focus is and what kind of programming or what kind of work that you do. But we really wanted to kind of maybe create an opportunity for you all to think about how you do incorporate young people. If your goal and objective is to reduce, for example, in our case, early substance use among young people, why not include young people in that process? And so here you'll see like what we call the flower of, or degrees of participation on how we can incorporate young people into research and into our work. And there are levels of degree. You can go from, like we have here, no youth are involved, all the way to the full spectrum of where young people lead and carry out initiatives. But where the real stars are, next slide, please, Dr. Powell, is in where there's shared decision making. So whether it's young people initiate and there's shared decision making with young people and adults, or where adults initiate or the program initiates and shared decisions with young people. There's a beauty in that, because then there is an opportunity to leverage and amplify the voices of young people, their experiences, and give them like what we call skin in the game, right? So like if they're actively participating and making decisions, there are things that young people will identify that we will never identify. Actually, recently I told someone, yes, we've all been 14, but none of us were 14 in 2020, and none of us would know what that means. So while there may be some shared developmental experiences that, yes, we may be able to relate to, there's something very different than being a young person in 2021. And so by having them as a part of your work, you're able to make sure that your programs, your initiatives really incorporate that feedback. And as anyone would assume, as the years change and as the times change, you're going to continue to make changes and adaptations to make sure that it's always relevant and salient. Next slide, please. And so with that in mind, the reason why CBPR works, and it especially works for young people, is because it's rooted in three basic things. It's rooted in trust and relationship building. And like any relationship or partnership, trust and having trust and building an authentic relationship is going to get people invested. It's going to get people open, and it's going to get people committed to doing the work. And because of that trust relationship, it creates opportunities to amplify the voices of young people, as I mentioned before. And then ultimately, it shifts this imbalance of expert and participant, right? Like young people, whether it's young people or whatever community you're working with, they really are the experts of their lives. Like you can't tell them what their lived experiences are. Even if you may relate to it, they still have the ability to tell you their own experience. So CBPR really creates this level playing field. That doesn't say that as a researcher, we don't come in with extra or specific skill sets, but that doesn't diminish the skill sets that those young people or the population that you're working with comes with as well. And based off of that, next slide, there's evidence to show that community-based participatory research has great impacts on young people. There's an increase in empowerment, so there's an increased level of perceived self-efficacy. So having the skill set and the capacity to do a something, whatever that is something is, there's increased motivation for change. And so going through the entire process of working with researchers, identifying a problem, identifying the root causes, collecting data, analyzing that data, interpreting that data, using that data to create something that is pertinent, really motivates young people. It improves critical thinking skills and problem solving skills. And lastly, it increases social support. So by connecting young people in this way, it opens them to maybe researchers or other community organizations that they might have otherwise not known and worked with. Next slide, please. And so
talked a bit about. I'll go. So what we talked about in our first phase, we talked to families, and based on our stance that CBPR is a valuable way to get information and to partner, we now want to talk a little bit about moving from participants to partners, where we actually engage our young people in developing intervention. All right, so Darian, I will turn it over to you.
Hello, everybody. I'm Darian, one of the participants who transferred to a partner. But it was really about the opportunity to learn, interest in research and interactive meetings, the consistent engagement between us, and the I guess the trust they showed us and the relationships we built really empowered us, and it made the relationship and the whole program better, if you ask me. Next slide. Our process, we work with 3 Black young adults, ages 21 to 24, affected by parental drug use to develop the BT intervention. Our weekly meetings for 10 months, of course. And then we use existing literary and expert consultations to develop program components, activities, and materials as a team. The Hopkins partner developed initial drafts and revisions of each intervention session, reviewed at least twice by members of the collaborative team during the weekly meetings. Our library partners were consulted about space, personnel, feasibility of activities in a library setting. Our consensus process was used to determine final content, activities, and materials. Next slide, please. And then the result of our partnership was the Better Together program, age-appropriate, cultural relevant, library-based intervention designed to prevent early substance use among Black youth ages 11 to 13, affected by parental drug use, developed in partnership with young adults and librarians. 800-minute sessions divided into 4 sections, interactive and didactic with homework and affirmations. Our long-term goal is to prevent drug use and its consequences among Black youth affected by parental drug use. Next slide, please. And our Better Together sessions, our introduction, of course, it was We All Better Together, about all me, managing emotions, having boundaries, all around me, getting connected, staying connected, community context, all about the future, decide and plan, review, and celebrate. Next slide, please.
And so Darian just kind of went through what our intervention development phase was. And so as Dr. Powell mentioned, we're currently in phase 3. So we've created something informed by, also informed and consulted and in partnership with young people that relate to this experience. But now we really need to know, does it work, right? we can have this great thing, but if young people don't like it, which is our first phase, which is what we call component testing. The other word for that, sometimes people use cognitive interviewing. But do young people like it? Do they like the names? Do they like the activities? Does the content make sense? Is it relevant? So that's going to be our first phase. And then after we have finished that component testing, we're going to take their feedback. We're going to go back and make some edits. And then based off of that, then we're going to train librarians, right? So this is a library-based intervention. And so we're researchers, so we can implement it, but can the librarians that we are targeting, can they implement it? And so we'll do some training with them and do another test run with them to implement it. And then lastly, we'll do a pilot test. Does it actually work? Now that we know, we're assuming that we know that the actual intervention is liked by young people, so we'll know that it's not because they don't like it if it doesn't work. We've trained librarians, so we know that it's not that they are not trained, but do we actually now see outcomes based off of this intervention? And so I think one of the key things for us to know is that this is an iterative process, and we are really committed to making sure that we created something that is relevant and pertinent and that aligns with the feedback that we get on every step of at every phase of our research. And so next slide, please.
And some of you may be wondering, you're like, hey, what are you going to do to train these librarians? You don't know if they want to do this or not. Well, we do, because the thing that we didn't include in this presentation is we actually fielded a brief online survey to ask librarians about their interest in and comfort around discussing sensitive topics, public health topics, ranging from trauma, substance use, sexual health. And we heard from about 300 librarians. So that's a small sample, but that's a lot of people to say something about this topic. And overwhelmingly, folks said that they were interested. They were interested in these topics. Many said that their libraries had offered programs around this, and one-off kind of programs, one-off kind of sessions. But they'd be interested in leading these sessions and definitely interested in receiving training. So we're excited about that idea as we move forward in phase 3. So now we want to get into like the where the rubber meets the road, right? Like, so how can you involve youth more in your programs? And as Asari mentioned earlier, many of you are already involving youth, so some of this may be a refresher, and we invite other questions if they come up. And so we have developed what's called a STAR approach, and this is again, if the end goal is for us to engage vulnerable youth in research and program development, like how do we do this? And so our STAR approach, it builds on some of the previous research and theory. So thinking about community-based participatory research, listening, other theories about, recruiting and retention. So we're researchers, we do a lot of reading of other people's work. But it was also informed by the Black families affected by parental drug use from our first phase. We really wanted to make sure we were listening to them and did things that they said we should do, right? That we maybe had not considered before. And so this approach has also helped us understand not only what works, but why. So it's not just like, oh, you partner with an organization, like, well, why does that matter and why would it work? And so the STAR is an acronym that stands for Safe People and Places Minimize Re-Traumatization. Teaming up with community partners increases acceptability. Addressing a range of issues helps them meet adolescent needs and help them survive. And then relatable facilitators are understanding and they're able to listen to adolescents. So we'll go through each one of these, and after each one that we go through, we'll have a slide for things you may consider for your organization related to each of these topics. So first, safe people and places, right? So as I mentioned before, many of the young people you work with that we talk to may have experienced multiple and complex trauma. And so like go into it knowing that, right? Like if you are familiar with any of the trauma-informed principles, like one of the main ones is assume that trauma is widespread and has long-lasting effects. And so we think, again, like part of the reason is that young people don't want to come to our services or participate in our research is that they're like, I don't trust you. I don't know what you're about. I don't know if you're on the take. I just don't have time for it. And so having safe people and locating services in safe places really helps. And in part because, you know, their trust may be lacking because their previous experiences of disclosure may have ended poorly. My soapbox, and I'll sit on it until something changes, is that, you know, we really need to rethink our involvement of social services, right? Like it's a blunt force item for situations that are very nuanced. And so a lot of young people, when they want to tell adults or about their issues, whereas our system is designed to keep young people safe, and it should be, often when social services are involved, kids become less safe, right? So if kids are not removed, parents may be upset and take it out on children. When kids are removed, they may lose the social network that they had or be disconnected with their siblings. And so in our efforts to keep kids safe, I think sometimes we don't consider all of the other ways in which we may be negatively impacting them. And so the need for physically safe places and emotionally safe people really bubbled up for us in talking to families and reading the literature, because there's just so few places that feel like that, and so few people who've made young people feel comfortable and feel like their information is protected and they're not judged. And our young people and our participants also said, even the parents said, the longer term program, so not just a month and not just one time once a week, would be really helpful in building these trusting relationships and creating safety and stability for young people. And so Darren, I'll turn it over to you.
Things to consider. Would youth rate my space as safe and accessible? Which people are youth most drawn to in my organization? How might we ensure that all employees have their core qualities?
And so if I could ask you guys, even in the chat or in the question box now, to maybe consider answering one or two of these questions, especially about the core qualities, right? What do you think are the strengths of the people who are already working in your space? Like when a young person comes, they ask for Miss Jones. Like, what is it about Miss Jones that really is attractive to young people? And so the second theme is teaming up with community partners. Excuse me, home is happening at home. My dog is teaming up with community partners.
Terry, if I can jump in, in the question box, we did have one person say that having non-judgmental attentive listener is one thing. Another person said, yes, our space is safe and accessible. We have all types of teens at our facility of all races. So folks, go ahead and keep those comments coming in.
Thank you, Susan. Yeah, exactly. Oh, what happened? Did you guys? Oh, no, I'm okay. Thank you, Susan, for that. And so the person who mentioned the people, we're gonna come back to that one as well. So teaming up with community partners, again, like this isn't a new concept. I'm sure many of you have partners, but what we've learned in talking to folks is that because of this in general, a very high distrust of people and systems, because not like, again, in interacting with them, young people haven't always had the desired outcomes. And we think we should go where youth are, right? And so actually, I was in a meeting earlier and we were like, oh, we have a website. And somebody's like, kids don't go to URLs. And we're like, absolutely, we know that, which is why we're making sure it's optimized for mobile use and connected to IG. And so there are definitely virtual spaces, but as the world is opening up, there are also physical places where youth go. And so we think that that's where we should be as well. And teaming up, like depending on, it depends on who you team up with, right? Like it isn't, not every person is viewed the same. And so as I have here, messenger matters, and figuring out who the influencers are, or who the people who are the trusted people, or maybe people aren't fully trusted, but they're trusted to do one or two things. And just being able to assess that and partner with those folks may be really useful. And as we were talking through this presentation, one of the things we say acceptability, but it's really that you need street cred, right? Like you need somebody to vouch for you. And I think when you're partnering with, when community partners trust you, or youth trust you who are in a community or working with a priority population, that goes a long way, right? It goes a long way to have somebody vouch for you. And so here are a few things that you might want to consider for your organization.
Things to consider. Is my outreach plan informed by a range of stakeholders? What are people saying about my org? How can I ensure that the message about my organization is consistent with its mission?
And again, feel free to drop notes in the chat about these things. And I will be honest, like these are things that we talk about on our research team and we constantly revisit. We'll have an idea and we'll think we're on the road and then we'll need to back up. And so it's okay to do that kind of process, to have a plan and then revisit the plan often. And so the A of the STAR is address a range of needs. As we've talked about before, what we learned from our earlier work is that young people are going through a lot of things, like young people affected by parental drug use. The parental drug use is one of many things that are probably happening. And so just being aware of that and understanding that family and community hardship may be common is important, and that our priority may not be their priority. So while we're here trying to focus on early substance use, they're like, well, I want to make sure, like my mom is okay, or that the lights are on, or that I can go to school and have clean clothes. Like, so there's so many other things that may trump the thing that you want to do for them. Or actually, I read it, there are a number of organizations, many of you are actually providing some of those basic needs. And so just know, like, your work is very much valued and needed. So continue the good fight. But in any one program, it's important to think about like beyond the individual, right? So the individual may have some, but focusing on the individual behavior of substance use or sexual health or delinquency, it just may be too narrow. Asari mentioned the term earlier, social determinants of health, but thinking about the web of decisions that young people have to make, and trying to have your program or programs address as many issues as possible, right? And for anyone on here who's writing grants, I know, I get it. We write grants. That is like impossible to actually write in a grant. But what I've learned is like, if you focus on one thing, we really may be missing the mark on a lot of the other things that may affect intervention or program outcomes. And so I think that programs need to have multi-level benefits. So if you, and I'm sure all of you would agree, if people are coming from programs, make sure they have food, make sure they're getting paid, and make sure they actually have enough food to take home, and not just for the people who are there. They have enough food to take home. You have some other things that you can offer besides money, because I think that while money is definitely important, we heard from a lot of young people, it's also some of the things you want that you don't get to get. And so some of our providers and parents were like, you should just go to Five Below and just get like a whole bunch of like little stuff that like trinkets, hair accessories that are just fun, because sometimes life feels so serious for young people that just having like a break and being able to be a kid is an enjoyable thing. So here's some things your organization may consider.
Am I clear on the needs of our clients? To what extent are my services aligning with the varying needs of our clients? And what ways might my work with our clients to better tell our
And then finally, similar to what the attendee said earlier about having non-judgmental people, man, like you hit the nail on the head. We learned that experience matters more than degrees, right? So it doesn't matter. I get it. Many of our organizations, we have to have like lower limits for education or training. But honestly, some of that doesn't matter. Like if you have like 18 degrees and are able to be authentic and understand without having to always want to fix something, I don't know how far you'll lead, right? And what we've learned is like it doesn't always matter if the person is of the same race or same gender, but authenticity matters, like being genuine about your own experiences and where you don't understand, and saying, rather than just offering a solution, saying like, wow, that must be hard and I don't understand that. And I think sometimes as adults, like, it gets hard for us to say those words, like, oh, I don't know what I would do. That really sounds hard, and stopping there, because we often rush to solve problems, and that's not always necessarily what youth want. And related to this, similar to what the attendee said earlier, who leads is as important as what is taught. If the leader is judgmental or dismissive or always interrupts, young people pick up on that super quick, and they respond in a way, like by withdrawing, either both physically or just like emotionally from the process. And so making sure that the people who are working with young people have a heart for young people, but then also like have done some deep diving and understand where they are, where their positionality, and how they might be able to where their expertise starts and stops. And I'll turn it over to you, Darian.
Things to consider: what characteristics are most important to our clients when seeking services? What training do we have to help our staff understand their positionality and capability to work with youth? How might we align hiring procedures to ensure we have the optimal people for each position?
And just to kind of add to that, I know we've been mentioning specific facilitators individually, but especially with this last question, I think it's really important as an organization to understand what your reputation is in your community, specifically if you work with young people. So we'll give an example. So Dr. Powell does a lot of work with churches. So she does a lot of work around churches and sexual and reproductive health. And so when we were in the beginnings, creating our program or developing our intervention, when we mentioned, okay, yeah, we're going to do this in churches, right? Not that the pastors are leading them per se, but we're going to use church spaces. And the young people were like, I don't know about that. Like, I mean, depending on which church, it matters. And so then that's how we kind of like shifted to another safe community space, and we landed on library. So even if you have the right people in a place, but what is the reputation of that organization? And understanding how young people perceive you and your organization really matters, because that could also be a barrier and a blockage as well. So something else to consider. So just as we mentioned earlier, we had some key learning objectives that we wanted you all to take away. But if you take anything away from this presentation, these are the 3 things that we want you to remember. Is that a partnership approach to program development and research ensures relevancy and salience to the target or the priority population. And that's what we want. Like I mentioned earlier, we put a lot of money into the programs that we use. Some of us are getting public funding. We put a lot of time and a lot of energy. And so we want to spend our time and energy on things that are actually going to be relevant to the target population that we're working with. And there are multiple ways to do that. First, understanding the context. Most people call that a needs assessment, but it's not just actually about the needs, but it's also about the assets, right? So both the needs and the assets of the community, sometimes people call them barriers and facilitators, but understanding that would allow us to understand who are the people, where are the places that we can really leverage to address the issue that is identified. As Dr. Powell mentioned, if we want to know something about someone, we ask them. So ask them, what are they interested in? What is important to them? As was mentioned, we're interested in substance use, but if young people are interested around contraceptives, or they're interested in teen pregnancy, or if they're interested on how to be a good teen parent, that's going to be what's of most relevance to them. And so why not start there and then look at root causes or other behaviors or issues that are worth paying attention to or worth addressing. And then with any relationship, as mentioned before, it takes time. So to do a good CBPR project, to build a good, strong partnership with young people or any community, it takes time, but it's a worthwhile process because everyone is invested. And at the end of the day, our key model to success in doing a partnership with young people or communities in general is that making sure that whoever your target population is at the center of your work. Because when they're at the center of your work, you're constantly reminding yourself, does this align with who we are addressing? Does this connect to them? Is this relevant to them? Are they engaged? Are their voices heard? Are their opinions incorporated? And so when you always make sure that your young people or your community are at the center of your work, it's very hard to go left, because they're the focus of everything that you're doing. And so next slide, please. We have, again, for researchers, I know this is not always applicable to everyone, but we've written some papers. And so these are some of our few publications that we've written. If you want them if you want to read them or you want to have access to them, you can definitely shoot us an email. In the next slide, you'll have our contact information, and we can send them send over a PDF version to you, because a lot of times if you're not in a research institution, it's hard to get access to peer-reviewed publications. And so if you have any interest in reading about our work, you can definitely reach out to us and we can share this with you. And we'll also have some like infographics, one-pagers that I think are a little bit more general public friendly and not academia friendly, that we can share with you as well. We have an infographic for the STAR approach, and we also have an infographic for our phase 1 findings that gives a little bit more information. And again, so it was such a pleasure. I just want to say thank you also to Susan. We didn't get a chance to thank her in the beginning, but we definitely want to say thank you to her to reaching out to us for this opportunity and to get to speak with you all. Based off of the registration list, we saw that people are coming from all across the country, and you're doing a lot of good work with different titles and communities that you work with. So we would definitely love to partnership. We would definitely love to partner with you and support your work, or help support our work as well. So here's our contact information. We are trying to be very in line with the time. So we are on Instagram more recently now. So you can also follow us there if you're active on there, to kind of see some of the things that we have coming up. And we are, we'll be able to post our website on there as well for you all to be able to have access to some of the information about our research study. And so if we have any questions, this would be a great opportunity. I don't know if Susan, if people can come off mute, or they want to just ask a question in person, or they want to type their questions, we are open to doing that in the little time that we have left.
Great. Folks, please do enter your questions in the question box. That will be the easiest way. And first, I want to just shout out your youth photographer. Oh my word, that was what great
so good
work.
Yeah, we hope we gave you a little taste of Baltimore.
And while we're waiting for some questions, we got a few more observations that came in. One was a person who said that he works with peers who are young, so they're familiar with the ever-changing youth culture, which is very important. Another person works at a child advocacy center, and they do work to provide a safe space. And we had a librarian who mentioned, when you said that it's hard for adults to admit that they don't always have all the answers. Said it's hard for a librarian not to just jump in and recommend resources, but very important to hold back and listen sometimes. And that actually raises a question for me while we're waiting for other folks' questions. Tell us more about how you focused in on librarians, and how did you make that first outreach, and what was the kind of reaction you all first got?
I can start. So it's funny, to what Dr. Afiyang said earlier, we were thinking churches. This grant was actually written for NIDA to be delivered in churches. And so actually talking to Darian and our other 2 young adults, we're like, okay, we're gonna go to churches. They're like, maybe, but not always. Like, you know, you gotta worry about people trying to make you join, and sometimes people are judgmental. And so we're like, okay, this might not be it. And I've done a lot of work. I was like, oh man, it like might not be it. And so we were in a brainstorming session, and we're like, well, what's safe? Like, where are places that people go? So of course we thought about like rec centers. We're like, but we need places in all communities. Like, what's in every community? That's how we landed at churches. Really, like, in Baltimore, there's like a church on every other block has a church. So, like, we need so community spaces aren't, like, not all the rec centers in Baltimore have been open. They've been closed for a while. We could do schools, but we would already like recognize some of the barriers of being in schools. And so this was literally a whole conversation. And we were like, well, what about libraries? And we were like, what about libraries? And I had just recently gotten a student who was a librarian here. She's a master's student. And so after this conversation, I reached out to her and I was like, hey, like, my team was thinking about this. Does this sound like a something? She was like, oh my gosh, that's exactly why I decided to go and get my MPH in public health, because I see so many young people, and I just feel limited in my training as a librarian to be able to address some of those issues. So, you know, like, even now I still reach out to her and she's like, no, kudos, like, keep going. Like, we can absolutely be prevention scientists with the proper training, because we see so many people at different phases of their lives.
And on top of that, I think it was so funny.
Oh, I was just going to hear some more from Darian about how did the library idea strike you, or did it come from you?
I was in a room full of women and they was just going at it, and I just agreed.
Well, do you think we'll get the young men into libraries?
Definitely. I believe they will see the opportunity and the benefit from it.
Okay. Sorry, go ahead.
I lost it. It's fine. Oh, okay. No, I do remember what I was going to say. I was going to say that after we just selected libraries as our space, I think we got a lot of confirmation, both personally and on our team, just to realize there are libraries that are doing a lot of good work, even internationally, and really seen as community spaces and health spaces. So, for example, I used to work in New York, so they were doing a lot of work around providing librarians with Narcan training and naloxone training, and having access to that, because, you know, people were overdosing in bathrooms and public bathrooms. So there already is a potential there to kind of leverage some of the work that they're already doing. So it just made sense. And they're open early and late after school, versus sometimes churches are not open during the week. Rec centers are not always open as well. And so it made sense once we got there.
Great. And we had one question that I'm just going to jump in and answer. Someone is wondering if they can get a certificate of attendance. So I do want to remind the audience that you'll get an email for a feedback survey, and that will be your opportunity to request the certificate of attendance or a copy of the slides today. So I loved hearing about the community-based participatory research. But I also sometimes hear some pushback, especially from those who haven't engaged in that form of research, that, oh, it's going to take too much time to reach out and really get the input of the community. How did you all reconcile yourselves to that, or do you disagree that it takes more time to involve the community to the degree that you have?
Well, I can answer that, and Dr. Powell, you can answer it too if you want. Well, I think if you're really interested in community engaged work and doing work that's relevant to communities, it takes time. That is a part of the commitment. There's really no kind of shortcuts to that, because then it is just your project. You can do a project and not involve folks, and, you know, a lot of people do that, and so you can do that. But if you really want to have a community informed, community engaged project, it's going to take time, and that's a part of the process. And I think that's the beauty in the process. As a researcher, I understand it's kind of hard to fund things like that. And honestly, a lot of projects have self-funded initially, and once they've gotten some data, then they're able to use that to leverage that information and that data to get more funding. But there's really no shortcuts to doing it, and to doing it well, in my opinion. I don't know. Dr. Powell's been doing it a lot longer than I, so she can answer.
I don't disagree with the folks with the pushback. I get it. Like it is a long process, as Asari described. I also think it's a worthwhile one. And the way that over my career that I've kind of reconciled that is to keep relationships going. Like don't stop when funding stops. So to try to keep in touch, whether it's like virtually or just giving updates. And then also having, it has been I've been fortunate to be able to have projects at different phases. So there are some projects, so this library intervention, we've done a lot of thinking about it, and we've not gone into libraries, and we've been talking to our library partners for over 2 or 3 years. Now, if this was the only thing we were doing, I may be out of a career. But in addition to this, I still was building on some of the school-based work I was doing. I was still like working with other community partners. So I would not advise anyone to start all new partnerships at the same time. Work on one, have someone else who has a nice, a nice seasoned relationship to be a part of their work or part of their research, because it does take a long time. And if this is the only thing you're doing all the time, it may not bode well for one's career. I'll just say that.
Well, I love the idea of starting things out self-funded to gather, to build the partnership and start getting community input, because, and I'm sure you found this to be true, it gives you a much more solid base then to pursue funding, because you can say, look, we've already got these roots, and here's what we already know is going to influence our success.
So the library survey that we mentioned, that was self-funded.
Oh.
We had to figure out, well, like, you're right, we didn't budget this survey, and we want to ask people, so let's find some pennies to do it. So, yep.
So I'm sure the librarian community nationally is going to be interested in that. Is that one of the things that's already been published, or are you still putting that information together?
We're still putting that information together, and this is relatively new to us, so we've learned so much about the library community. I mean, the different caucuses, like we follow, the American Library Association. We're like, wow, like how have prevention scientists missed libraries and librarians? It's, it's pretty amazing, and it's impressive what they've been able to do as a part of one of their strategic goals. The American Library Association has, like, increasing their outreach. So what better way than to think about the needs and the issues that the communities are struggling with and try to address those. So we're really excited about first our local partnership. Let's figure out if we can do this thing, and then that is really one of my visions, that we are partnering with libraries across the country and implementing substance use prevention programs for young people. So look out for us.
All right, that's a happy note to end on, and we're a couple minutes over. So I want to thank you all so much. I am so energized by your project. I'm like, oh, Baltimore isn't too far away. I should just step up there and help out. So thank you all so much for this exciting, the work that you're doing, this great presentation, your willingness to share with the audience, and your willingness to be open to requests from the audience. And folks, the presenters did mention their published work. Remember, you can also get copies of that through our librarian at the Center for Victim Research. So that's librarian@victimresearch.org. But I don't want to keep you from having a reason to reach out and make personal contact with these terrific folks who could help provide some guidance for your own projects. So with that, I'll say goodbye to everyone, and we'll conclude today's webinar. Thanks so much.
Thank you.